Wishing you all a fabulous day. It is my pleasure and honor to introduce you to another unique academic neurologist, global health-related neurology expert who is now leading a special group globally called Global COVID-19 Coalition. It is actually through this coalition that I got to know her, and as her story is quite inspiring, I thought that I would bring her along to the World Federation Neurology social media team, World Brain Day team, and YouTube channel. Very good morning to you, Andrea. Thank you so much for giving us time to talk about you and a few other things, despite your busy schedule.
Well, thanks a lot for the invitation, Thyssen. Great pleasure to be here with you. Thanks a lot.
Andrea, you are from beautiful Munich. I have been to Germany multiple times. It's a fabulous place, and when you study history of Germany, you get enormous amount of courage about the whole humanity. Whatever the calamity or whatever the threat or whatever the pressure that you have been thrown at, together, collectively, unified way, you can overcome them and become one of the most powerful nations in the world and make a global contribution. But today is not to talk about Germany. I want you to tell us how the Professor Andrea Winkler was made to this world. So tell us about your high school days, university days, what inspired you to do medicine, why neurology, why global health. So take us through the memory lane.
Well, thanks a lot, Tissa. And this is now not prepared. This is all rather spontaneous. So my decision to study medicine was a very spontaneous one. It was a spur of the moment one evening. And I always knew that I wanted to go and work in Africa and that I really liked biology and medical sciences. So I just combined it and I said, okay, I really loved languages, but no, it has to be medicine. It was really very spontaneous. And I would say it was the best decision in my life. I've always had this also altruistic, but also attracted to science and wanting to know more and going deeper and deeper and not resting, asking questions. It was always inside of me. And I'm still carrying this actually. And I can drive my family crazy by asking questions, why that is. And so that all of that was combined really then in my medical studies. I combined the medical studies with going abroad and working in different countries. I went to Africa, to Brazil, to France, to the UK. And that was really very, very enlightening, of course. But then I also trained as a proper neurologist, and I took my training very seriously. But from the beginning, always looking a little bit further and thinking how what I'm doing now. And I got attracted into neurology because I love the neuroscience bit. But then I really wanted to combine this with my global endeavor. And I couldn't quite. So we talk about, that's almost 30 years ago, which is quite frightening, actually. But then global was not on the agenda, not at all. And it was not even working with other disciplines. You met maybe for a patient, you discussed the patient, but then everybody went back into their own discipline. So that inter, or even transdisciplinarity that we talk about these days, it was not there. And then, of course, you meet people and you meet supporters. Then I went to Africa and I worked there for 3 years. I set up clinics for people with epilepsy. I was still a young doctor training in neurology. And when I came back home, I found people who basically invited me in and said, well, that's good, you can establish this here. Then was tropical neurology. It was not really global neurology or global health. So I finished my neurology training and I became a specialist neurologist here at the Department of Neurology at the Technical University of Munich in Germany. but I went ever so often. I went abroad and started my research in Africa. And then roughly, I would say 10 to 12 years ago, the German government started new funding schemes. And for the first time, these was funding schemes that were set up for collaboration with partners in Africa. And I had already lived in Africa for 3 years. I had my partners. I worked with institutions in Africa, so it was quite easy for me to assemble the group. And we were successful to gain our first ever grant on a global topic within neurology, and that was basically on neglected tropical diseases. It was the pork tapeworm that causes neurocystic psychosis, and that actually can be up to 30%. Can be the cause of epilepsy in up to 30% of people in endemic areas in Africa, Southeast Asia, and Latin America. So the neurology was the entry into a wider, huge field, which then, of course, became global health. That then 10 years ago, 8 years ago, it was more on the agenda. Before it was tropical neurology, and then it became global neurology within the field of global health. Maybe I stop here. I could go on, of course, but we then, a couple of years ago, also founded a Center for Global Health at the Technical University of Munich to flag the global collaboration and the importance of the global collaboration, the networking, the joint grant application, the partnership with other countries. And that was well received. That is actually, we do that in a co-joint directorship construct together with a colleague, an infectious disease specialist, Clarissa Prazeres da Costa. So we've been doing that now for a couple of years. And in between, I got a call for a professorship at the University of Oslo, and also was the founding director of a Center for Global Health there at the University of Oslo in Norway, Scandinavia. So then that was over the last 6 to 7 years, I got a lot of experience how to actually bring what I experienced myself by working on the ground in Africa, by bringing that to the table within universities, and to bring in young and old colleagues who are interested in collaborating and pulling up things that were not there before, I would say in a rather unconventional way. And now I really stop here, Tissa. Sorry, that was quite long.
No, it is not. It's a fascinating story. I got a lot of questions to ask from you. But before I go into those questions, as a young neurology trainee, when you landed in Africa for the first time, what was the experience like when you walk into an unknown country with some patients probably not speaking in English? What was the experience like? Just share some of the anecdotes, good or bad, or challenging, or some memorable things that you can share with us.
Yeah, no, thank you, Tissa. I mean, that to me, it was always, and even up to now, when I'm in Africa and we're going out into nature, it's always, and it has remained mind-blowing. So when the first contact with Africa was when I was 23, and I started out for an elective, so I was already a medical student, and we traveled with my boyfriend. Then we traveled through Kenya, Tanzania, right down to the southern part of Malawi, where we spent 6 or 8 weeks doing our internship. And when I came back after 3 months, it was honestly, I had to resettle into sort of the high income world. And I realized that many things that we took for granted, and as a young person, I took for granted, of course, is not to be taken for granted. So when I landed there, I felt I was in a movie, non-stop movie. And everything was new, everything was exciting, everything was mind-blowing. And it has retained the charm, but it's not just that. I mean, you're confronted with huge poverty, with suffering, with diseases that you would never dream to see and to be confronted with. So there was this, I just knew I was where I should be, and I could make a difference. And I could learn so much also to take that back home and to share. And now when I go back, when I touch ground and I take the first sniff, then I get the feeling again, this Africa feeling, both in a positive, but also, of course, in a challenging way, where you just realize so much should be done. There's so much lack of resources. You need to let go so many times. People are dying that could be saved in different circumstances. And there is frustration. I mean, I cried when during my 3 years. I cried often when I lost patients and I couldn't help them, although I knew what should be done. So there was also lots of frustration. But then to work with African colleagues, it's just so stimulating because they fully embrace life. And I think maybe this is what we have lost in the richer nations, to really embrace life, to embrace health, and to embrace medicine, and not to take everything for granted.
I totally agree. In fact, I can relate to some of the things that you mentioned. As you know, I am originally from Sri Lanka, and up until COVID-19 hit, I still maintain some academic appointments with universities in Sri Lanka. I used to travel 5-6 times per year. It's absolutely crazy. I would leave Melbourne Friday evening because there's a 5-hour gap. You would land in Colombo by 11 o'clock. You would work Saturday and Sunday. You might invite your parents you pay for their travel, and you might see them at a junction, or as you are commuting to one of the university or hospitals to do teaching or do other activities. And I can relate to you that when you sniff and when you smell that air and the difficulties, those challenges, you almost feel like I shouldn't be complaining on the things that I'm not getting in my own institution or own place. We do complain, of course, because it's a competitive world, but I absolutely agree that there's so much to learn and gain from resource-limited countries when you see what they can do. Similarly, there's so much to gain from the well-developed places also. Say, for an example, when I studied the first neuroscience chair in Australia, who passed away a few years back, the passion, the desire to build academic institutions, this gentleman basically put up a big fight with internal medicine colleagues, not even having a proper job. To do his first neurology clinic in Australia, he had to do 6.5 days general medicine work. Then only he would be allowed to do a dedicated neurology clinic. But then before he retired, he has established at least 50 neuroscience chair positions right around the country. Of course, one thing that was easier for him would have been less competition at that time compared to now.
Nowadays, yeah.
But I think combining East and West and combining and sharing these experiences together, we can build a much better world. I do have a lot more questions, but I'll keep them for a different day. Otherwise, we would not cover this interview during the time that we allocated. But I'll pick one question. You, having your infectious diseases colleague appointed as the co-chair or co-director in the Global Health Institute in Munich, would have been a God-given when this crazy pandemic hit us. The early in the year. So it then become no surprise that Professor Andrea Winkler wanted to have a sort of a global COVID-19 coalition to put heads together as much as possible. So this is basically keeping in par with what we have been doing behind World Brain Day. In fact, the story behind World Brain Day is about 10 years ago. A few of us had a casual chat while at a World Congress Neurology. I was a very junior neurologist at that time, but I was still involved in some of the advocacy work. as Professor Hachinsky picked me up as I was raising some questions at a young neurologist workshop. So we were basically talking about, just like you were mentioning that when you travel to those countries, you became quite fascinated and became embedded in more global approach, not knowing that you would end up running a global neurology institute. Similarly, we were in this casual chat, we were talking about, I was still based at Melbourne, but my hospital catered for people representing 166 countries. So for every day when I go to work, doing a clinic, you see someone from sub-Saharan Africa, you see someone from rural, the remote place in Southeast Asia. So they would tell you that they speak this language that you never heard before. So you quickly Google and see what that language is, or they would mention a small country in Africa that you haven't heard before. So you quickly Google in front of them and then, right, oh, there is a small country next to that and you are from that place. So you sort of share some the experience, what sort of a food, what sort of a culture, this and that. So although you might be a neurologist locally, you still have to cater for a global population because they bring those geographical neurological disorders. So we were basically chatting away that how we are interconnected despite we look different and our food preferences probably different. If you go out, I might choose a different food. My colleagues from Pakistan might select a different food. My colleagues from Berlin might pick a different food, but we still interconnect with this common desire to promote brain health. So casually we felt that perhaps we should have something called World Brain Day so that we can promote brain health in one world as this is a matter for concern for all of us. So as it happened, Professor Hutchinson was there also, and then he sort of, as ever casually said that, why don't you all present this to the Council of Delegates meeting tomorrow? Let's see what's the take up from other countries. So we had 122 country membership. Each country had a vote. They unanimously vote for this to be upheld. And basically, committee was given the task to run the first World Brain Day in 2014. We had no money. We were all working full time. Some of us were having very young families and struggling to cope, and none of us had run a Brain Day campaign before, but we pulled it together. But year after year after, it basically expanded beyond our belief. During the last couple of years, we would partner with a further organization. Say, for an example, last year we partnered with the Movement Disorder Society. The year before, or in the years back, World Stroke Organization, International League Against Epilepsy. This year, we are partnering with Multiple Sclerosis International Federation, which is a global advocacy group basically promoting multiple sclerosis care and access to treatment, diagnosis, and so on. So what we then basically do is we create contents. Basically, a couple of us work extra nights and weekends. We initially didn't have a commercial partner to help us, but for a little amount of money, now we have someone helping us out to make it look more professional. So we basically, our content has a basic slide deck on the disease that we choose for that particular year. Then we create a whole lot of social media material. Last year, I was chairing I have been chairing this for several years now. Last year, I was basically worried. I couldn't visit any country, and we were in the middle of a lockdown. Melbourne, basically, people were dying in every corner, as you could remember, as we were attending the coalition, the meetings. Then I was heavily involved with translational research. On one hand, there were manuscripts all over my study room floor. And but then I had to chair the World Brain Day. Also, I was initially scared worried whether I could deliver a meaningful thing. But quickly I figured out that you could visit many countries virtually that you couldn't do physically. So normally, on a normal year, you would visit like 5 or 6 countries because you have a family to feed, you have patients to be seen, you have a department to run, rest of the other parts of life has to go on. But last year I was able to visit something like 66 countries virtually. So I visited most sort of amazing African countries to talk about what sort of a movement disorders program that they have, what sort of problems that they have. And I realized the power of social media. And we hit almost close to 100 million mark last year. So this year I set the agenda.
Wow.
This year I set the agenda with the other committee members. All right, we have 2.8 million people with multiple sclerosis right now. Let's ask our colleagues to post something on their Facebook, Twitter, LinkedIn. I support World Brain Day. I care for brain health. I endorse World Brain Day. Something to do with brain. If we get 2.8 million people posting them, as you and me know, each one of us has anything from 100 to 1,000 to 2,000 friends, so-called, or followers or links in them. So you basically can easily surpass 150 million mark without spending a cent. So this year, we having that in our mind, all these video clips that we are creating, all the contents that we create. If you go to World Federation Neurology website, if you click World Brain Day, there's a Dropbox where we put all these things, including a couple of press releases. So even those press releases, say you wanted to issue a press release from your Center for Global Health, all you need to do is to get your secretary to download the press release, remove the first bit and last bit, add your institution to the top bit and last bit, and add contact my press office for further information. And you run your World Brain Day campaign promoting brain health in your institution. So we want that to be done all over the world. Because we have 122 countries, if each one of them start doing them, I think gradually we will put brain where it should be. And you and me both know COVID-19 has firmly reminded us how critically important health is. There's absolutely no economy without health. And there's absolutely no health without brain health. At the end of the day, you have to have a reasonable functioning brain to have any hope of any health. I'm not downgrading other health. Of course, they're all important. But for you to maintain physical, mental, and social well-being, just as World Health Organization defined health in 1948, it goes without saying that properly functioning brain health and preserved brain health is mandatory for that. So the Professor Hachinsky, being the smart cookie he is, he redefined brain health just a couple of weeks back when I saw on a correspondence in Lancet Neurology, basically saying what I just said. But it would go under his credit now, but that's okay. He's a wise man. And so I think he's absolutely spot on. You need to have brain health. And what you and me doing today is doing our bit to promote that so that we can have a healthy human brain health all over the world, so that when our time comes to leave this planet, this world would be in better shape with better brains. So that's the sort of a story of brain health, and it has certainly grown from strength to strength year after year. And this is our 8th year, and it has now become probably one of the most major activities of World Federation Neurology, in collaboration with all other global neurology groups globally. So as you can see, the reason that I gave you that long explanation is to draw the common theme that you put forward in global health and global neurology, how it is fitting in very nicely with what this program is trying to achieve also. Our goal is very simple. We just want policymakers and political leaders to support brain health and preserve brain health as best as we can, so that they can run their country smoothly and their citizens can live as happily as possible, irrespective of the resources that they have. You and me both have seen enough. It's not the amount of money that matters. It is not the amount of resources that matters. It is how you bake the cake with the ingredients that you have to maintain the best health that matters, isn't it? We know that more of everything almost never give us the satisfaction or joy or health for that matter, despite health been an expensive thing. So that's sort of a journey of World Brain Day.
No, excellent. Thanks for this really in-depth explanation. And I was just thinking, while I was listening to you, I mean, that is really about global cooperation, using innovative tools. I mean, Zoom meeting is not so innovative anymore now, but using the social media and using the snowballing principle, it can work amazingly. And of course, I'm very happy to hear that this year's topic is actually multiple sclerosis. The Department of Neurology that I'm working at, that is led by Bernard Hammer, is very strong and has a very strong emphasis on multiple sclerosis. So that is very close, at least what I can say, to our hearts. But of course, MS should be close to the hearts of many neurologists and non-neurologists. I think we need to be also aware that we need to step out of the shadow of our own disciplines. The more we reach out to other colleagues, and Tissa, as you know from the coalition, although most of us are neurologists, but we also have other disciplines within the coalition, and we have actually not just other disciplines, but we have other perspectives. We don't really look at neurology like from a very scientific perspective. We look at it from a public health perspective, from a patient's perspective. So it all really depends on which angle, which lens you're using. You can always discover something new. And I think to have this massive information campaigns, and always, of course, focused on a topic, and I hear now, understand how it has evolved, is very timely, and informed decision making is so important also in times of infodemics, when you don't know what is right and what is wrong. So to have that on a World Brain Day, to have that out from the World Federation of Neurology partnering always with the Mellon Society, which of course is really solid, solid support. I think it helps to demystify. It helps to also bring the evidence to people's homes, and of course to colleagues all around the world, and to raise awareness of the plight of so many patients and their carers, not only within their own countries, within our own countries, but globally. And Tissa, as you know, I mean, we don't actually know whether MS is an issue in areas of sub-Saharan Africa. We always say that there's no MS, but we haven't looked. So we haven't looked properly. We haven't looked carefully enough. So raising MS also with societies and associations from sub-Saharan Africa, where MS is presumed not to be there. I think it's very important to advance science, not just to advance knowledge and to advance cooperation and collaboration, but also to advance the thirst and the hunger for more science on whatever topic World Brain Health Day is dedicated. So congratulations to this huge endeavor, and especially in times of the pandemic. I think you couldn't have done better.
I can see your excitement, and I think you hit the nail on the head. The only other thing that I would probably add to this discussion is you and me both know, compared to our student days, today MS almost can be stopped because we have such powerful armamentarium of therapeutics. One of the reasons that we choose this disease this year is we do know that despite we have highly effective therapeutics, probably at the top level in any aspects of neurology, in MS, 70% of the world cannot access them because of the prohibitive costs and not being able to access them. 70% of the world cannot access early diagnosis either. But then, as we neurologists keep a very smart eye on other things, we quickly learn how the world come together to deal with this pandemic. World Health Organization correctly and appropriately advocated for vaccine access to all countries. This is a global crisis. The solution has to be global. And then recently concluded G7, the summit at Chatham report, the powerful political leaders promised to tackle this as a global problem for the first time. We haven't seen anything like that before. This is to deal with this pandemic. So our argument is we have a disease that is largely affecting young people. There's someone somewhere get diagnosed as having MS every 5 minutes. Mean age of diagnosis of MS is at 32 years of age. You and me both know that when we were at 32, that's the time that we are planning to have some place to stay, whether to have a child or not. That's a sort of a very active planning stage in your prime time in life. That's the mean age that we give this the remarkable diagnosis to patients globally. So on one hand, we have a disease that we have resolved most of the issues. There are unresolved issues, as you pointed out, in Africa and other places. But we also come thus far that we can melt away MRI lesions. We can melt away disability in MS with highly effective treatment. Yet, 70% of the world cannot afford them. Hopefully, we can convince WHO and other powerful nations that there has to be some way that we bring some sort of equity to at least most essential medications that can be used, just as we are dealing with this pandemic as a global community. That's one the thing that we choose this particular disease. And the other thing that you very correctly pointed out, this is not only an issue about neurologists. When we look at countries without neurologists, those countries still have medically trained people. And if brain disorders are the leading cause of disability in the world, if 90% of the brain disorders can be prevented reasonably well by a whole lot of preventative measures, that is a message that we should be able to drive home to whatever the healthcare work groups that those countries have. And I completely agree with you. I think you were very wise mentioning that it is all about collaboration, synergy. And I tell my juniors that if you wanted to be a super competitor these days, the way that you win competition is becoming the best collaborator in the world. If you can't be a collaborator, you are a loser, basically. You cannot stay in this game if you don't know how to collaborate. I completely agree with what you mentioned on that. And the in World Brain Day, we just provide platform for those collaborations to grow and the people to keep advocating and bring that synergy as best as possible. A few years back, I told the same thing when we were advocating for better migraine care. The problem for migraine is underdiagnosis. People just, because it is hard to take a history and the patients are suffering and they're not happy people. So you need to be very patient to extract decent chronic migraine history and the medication overuse headache history. I always tell my junior doctors that I almost test my young neurologists by giving them a really hard yaka complex migraine patients to tease out. If they tease them out, they survive. If they can't tease out, they're probably too soft to be in this job, in public system at least. So it's all in synergy, isn't it?
No, absolutely, Tissa, I fully agree. And I mean, this discussion is so fascinating because it has got so many different levels and layers. But when we talk about access, and it's good that you mentioned this, I wasn't aware that 70% of people suffering from MS can actually not access the medication they would need. I mean, this is appalling in a way, right? So the word that I would like to throw in here is actually equity. it's the global health equity, or maybe equity, if I can explain that, to reach a certain goal or a certain outcome, some people, some regions of the world need more support and others need less support. And to give those more support who are in need of more support, that is about equity. And then at the end of the day, we shall reach equality, looking, for example, at access to MS medication. So that is also part of that global collaboration and the global collaborative spirit. In partnership, right, is that the mutual learning, the mutual support, but also realizing where issues are, and then focusing the support on those problems, and not saying, oh, I would like the same amount. Well, it's already working quite well with us, but let's focus now on whatever country or region that is that doesn't have the access that it should have to whatever medication for whatever disease. Let's focus on that region and let's try to give them the support they need to be able to reach the level we are at already. And then we have equality. We have equality through an equitable approach. And I think this is fantastic also, that within the World Brain Day, that you're bringing out those discrepancies, those differences in access to healthcare, and in healthcare that people would need at a certain stage in their life, and especially now talking about young people when we talk about MS diagnosis.
I think absolutely, and the part of we both know that this is a continuous learning. This year, World Brain Day, I had the opportunity to, I'll basically give you two convincing stories on what you just said. My first teacher in neurology, who is a retired emeritus professor of medicine in Sri Lanka now, I couldn't get hold of him for interview, as at the age of 65, he basically cut loose with all academic things, and he became interested in music, and he did not want to do any academic activities. He's a brilliant human being. I'll tell his story on a different day. But this year, after, that I persevere with things, and I wasn't going to give up. I wanted his story to be recorded as I knew his story. So his story is, he would go to the Queen Square, London at the age of late 20s to train in neurology, spend 3 years there, come back to Sri Lanka, and then become a senior lecturer. And then he would realize that there was no EEG machine in Sri Lanka at that time, and no one has sorted out epilepsy in Sri Lanka. Imagine that this is a full-time senior lecturer, a lot of teaching, a lot of clinical work, absolutely no research grants, no research support. So he would accidentally meet late Professor Harry Mianardi, the great epilepsy leader that Netherlands produced, who himself was an orphan, and it's a different, fascinating story. He passed away some times back. So the Professor Mianardi would give him a basic EEG machine. Professor Mianardi would teach him why he wanted this particular young academic to meticulously record what he would do. This young person, despite all those busy things, he would go home, he would train young girl how to do EEGs with the help of Professor Mianardi, who would spend a couple of weeks in this sort of semi-rural city at that time in Sri Lanka. And then he would approach one of the volunteer organizations leader in Sri Lanka, and he would ask this. He would say that, I don't have any money, but can you give me the cleverest, most educated 2 volunteers from each village, so that they could come and spend 1 week with me in my medical school. Me and my Netherlands friend, we would teach them how to pick up potential epilepsy cases in their villages. So then they would have sort of a few hundred young boys and girls who would be taught how to take epilepsy history. And then they would deploy them to this province. Within the next year, he would have 1,400 plus potential epilepsy cases that were picked by non-medically trained people. Then him and Professor Mianardi would do EEGs on each one of them, and they would classify them according to whatever the international association that they had in epilepsy in late 1970s. I was probably not even in high school at that time, probably only a few years old, and they would describe probably the most well done epilepsy epidemiology study that I ever read anywhere in the world, even today. And that would be done and dusted. So that's one example from the old day. Then I interviewed another chap who is not a neurologist. He's a young guy in his late 30s, early 30s now, full professor of parasitology in a sort of university that I work as sort of philanthropic capacity as a professor back in Sri Lanka, youngest medical school, one of the young medical school. This person, immediately when he was graduated, he would become fascinated in biology, and he would come to know another Sri Lankan biologist who has absolutely got nothing to do with medicine, who is excellently trained in King's College London on basic scientific questioning and methodology. So he would read Nature regularly, Science regularly. He would have some money to do sort of the diversification of fish, other sort of animals, so on and so forth. This boy would spend 8 months under the umbrella of this biologist who would only have a master's degree. I wouldn't say only. He would have a sort of master's from King's, but brilliantly trained nonetheless. So he would learn how to question in scientific ways and how to write papers and how to read critically during those 8 months. Then he would choose an academic career. And then he would get a scholarship to come to Australia to do his PhD. And now he is one of the pioneers in neuromuscular junction snake venom toxin. And the reason that I interviewed his story is I just wanted the world to know that if you give a bright young boy or girl an opportunity, they would go and do things that would have implications for us. What he does today in snake venom toxin might give us clues to sort out autoimmune disorders for many other things. So when we talk about collaboration and network, it can go in multiple ways. It is not about giving truckload of money. It may be giving one equipment, giving them the tool, giving them the opportunity, and then they would go and unravel mysteries that would fix many problems.
These are really beautiful, two beautiful stories. And I had the honor also to meet Professor Mainardi before I actually went to Africa. And he also gave me some really good advice. And then I did something very similar, although 20 or 30 years later, then that story that you had and approached epilepsy in Africa in a very similar way. So you're right. And the second story is just as fascinating. Just as you say, if you support motivated and bright young people, it is the seed that we are planting is just amazing. And I also trained partly at King's College Hospital. So that's another, for the second case, I also have my personal linkage there. So these were two very beautiful stories, Tissa. Thank you very much for sharing.
They are absolutely amazing, and so that's not knowing. I have been adding these stories to the WFN archives. It was initially I was wanted to create contents of some joy and the people to learn from other sort of the decent human being stories. Then I realized that some of these stories are so powerful and they must be told and they must be recorded for the benefit of humanity.
Yeah, and, it's a brilliant idea.
And that gives us a segue to our last question. But before I throw you the last question, tell us, I know that you work extremely hard, and tell us how you spare time when you don't do global health or neurology. What do you do to keep yourself relax and maintain your work-life balance?
Yeah, no, that's most likely, that's the most challenging questions from all the questions so far. I don't have a recipe. I also have to say I'm not a super relaxed person, and I accepted my personality not being relaxed years ago, and that was quite helpful. So I always have got something going. I hardly go and relax. So if work is never finished, of course, but I know at 7 o'clock my son comes home, and then I have to cook, and then we're gonna sit down and we'll discuss. So I draw a lot from family, and from doing things together with family. Of course, friends that have actually stood by my side throughout the years, because I traveled so much. I was abroad for such a long time, but a handful of good friends. I find it very relaxing just to actually chat with them and not set a time limit. So the other day I ended up chatting 4 hours with a girlfriend. And that, to me, it gave so much energy back, as if I was on a holiday for a week. So it is really this human contact. I'm a very human person, the human contact, the family contact, the friends, but also music. And I'm not saying any particular music, classical music, no, but music in my head. So basically, it's that when everything goes quiet and I have the chance to be in the home office, and the Zoom meetings are gone, and things go quiet, to have music in your head. I think it's very important, because that will always bring you down. I don't do a lot of sports, and that's not a good thing. I would really advise against it, for sure. So whenever you find time, I think it would be really nice doing sports. I love nature. I draw a lot. I don't do nature so much here, but whenever I'm overseas in Africa, I do a lot of nature. And that is also very, very fulfilling. So that is basically, and what I also do, Tessa, I think spirituality is important. It doesn't matter whether you are Christian or Hindu or Buddhist or Muslim, it just doesn't matter. But what really helps me in stressful times, and the last years also bringing up a child on my own have been really stressful. In the morning, I take just a couple of minutes, not long, and I step out onto the balcony. I look into the little forest that is just opposite, and I center myself. I look into the day and I just center myself. I ground myself, and I get myself prepared in a sort of spiritual way for the day. And that is helpful when you are actually centered and grounded. Then of course, you can even tackle situations that may be unpleasant and may be stressful. But you need to write this into your agenda, because otherwise it will not happen. No. So it's when I get up, I'm very structured. It's crazy in a way. It's obsessive in a way. But if I'm not doing my program, then I'm not getting through the day well enough. Then I'm not a good person to talk to at the end of the day.
No, I totally agree with you. I remember, I think when I was a second year medical student back in Sri Lanka, as you could figure out, I spent a couple of months before we started third year in main city, Colombo, because I was a reasonably well-known journalist at that time for a science weekly. So there, I could spend some time in the head office, which was a fun thing to do. You get free movie tickets. You get to do crazy things with other young boys and girls in sort of newspaper circle. I was the only medical student. And the second thing was I was doing some research work for which I was getting some extra cash. Then I had acute appendicitis and I was admitted to the hospital. I was staying with one of the doctor's room, who was a few years older than me. Because my parents were from rural cities, I told him that don't tell them, and it would cause problems for them to come all the way here. Because I figured out that because I was with doctors, I would be safe. But I didn't realize that not having friends and not having family I was getting depressed, which I didn't realize. So I recovered and I took a bus and went back to the medical school and hand over my research work. And at the same time, as I criticized some of the traditional medical works on a sort of center page article, which I wrote before I became sick, the whole indigenous medical community was attacking me on newspapers, in national media. So it was a bad time in my life. So I was too sick to respond to them either. So my sort of supervisor told me that you go home and spend some time with your parents, and once you get better, come back. I was literally depressed and suicidal at that time. I mean, I was a second year medical student, so I did not know what depression was or what suicidal thoughts were. I had a sort of a clear plan to end my life, but my home was it still is my parents' home, I should say. It's in one of the most beautiful places in Sri Lanka, on top of the mountain. And I remember vividly when I had arguments with my mom, arguments in the sense she would blame, we wouldn't talk back to them. That was not allowed. But deep inside, you wanted to argue with her, but you are fearful with your background that if you raise your voice, that would be a sin and this and that. So you keep those thoughts in your mind. And so I would sheepishly climb up to the mountain. And when I see the clouds and trees and birds, you calm down quickly. So with these suicidal and depressed thoughts, with the handwritten note in my pocket, so I would go and spend the time under a tree, looking over clouds and the enjoying breeze, how I wanted to end my life with less agony to anyone else. But one day, as I was preparing my journey, part of my brain started to give me the spark that keep me alive to date. It started to tell me to look at some of the trees and some branches which are dead, but they were young. And some branches, you would want them to be dead and fall to the ground, but they're still not dead and still having some sort of a life in it. Same with flowers. So the part of that brain started to tell me that, look, in the case of you, although you have a name and fame as a young journalist, winning some awards and this and that, few center page articles, and the only medical student from this rural village, you are not different from this tree or branches. Look at the way that those tree branches do not decide when they end their life. Nature decides when they should go. They don't take a deliberate attempt to take that. So why do you think that you are somehow special to think that there is no meaning in your life and end your life? So then, fortunately, networks in my brain started to feed this circle more and more and more. So you become more sort of noticing how you are part of the nature and you are nothing but another matter of that nature whose purpose is to do a particular task. At that time, my purpose was the whole villagers coming to see me and meet me and greet me with a whole lot of little gifts and food and some cash. So my job was to play the role of the recovering patient and then appreciating their care. So that was basically the sort of end of that. So the reason that I shared this story is to confirm how very important the spirituality, whatever the religious belief that you have, or whether you are atheist or not, keeping grounded to you. Nowadays, I think for a long period of time, if I'm walking with my dogs, or if I'm doing a brisk walk, even between really crazy meetings in hospital, most of the time I sort of have this thought in my mind. When I put my left foot to the front, my mind tells me that you are dying, and the other foot, that's for sure. So it's basically reminding me that there's nothing the important other than living for the moment. So you could basically deal with any negative thing that you have to deal with at a particular time, because you're grounded. You're sort of the grounded on the floor. So you could deal with rejection of papers. You could deal with the difficult encounters with patients and families. You could deal with difficulties in sort of missing flights or the other crazy things that happened in your life. I think that also gives us a nice segue to the next question. I personally think the next phase of neurology and brain-related research would be tackling these soft but very important entities, mindfulness, kindfulness, spirituality. People have started looking at them from biological sense. So putting that into your head, what is your message to youngsters that are out there, whether they're high school kids or medical students? Why do you think that they should seriously consider pursuing a career in brain-related fields?
Why they should pursue a career, because it's the most fascinating topic. I mean, neurosciences and brain health is just utterly fascinating. And if you are a scientist, but from the bottom of your heart, and every breath that you take is science. I think neuroscience is one of the most fascinating sciences to take up. I would also say another advice is that you need to feel, it's important to feel called to something and not to do something because you think that you may earn a lot of money with it. Actually, in medicine, this is not the case, at least not where I come from in Germany. You certainly don't get rich with practicing medicine, and you will get much richer if you go into economy or you run a business, you go to the stock market, to the stock market exchange, and you're trading something. So you need to feel called to medicine. You need to feel called to the brain and neurology. I think that's important. Don't just think that you have to do it. If you feel called to something, then of course you don't work even a single day in your life. This is what we say. But then hardship, and every career will hit hardship and challenges and not so good times. But if you have ever had the feeling this is the right thing that you're doing, it's not second best. It is what you wanted to do. It will carry you over and through those more difficult times when you get more frustrated, because there's always, and of course it picks up again later on. So my advice to young people would be really go try out. If you're not sure, take some time. Of course, you have to talk this over with your parents, and it all depends on finances, but also try out. Don't go for the first thing that if you're not sure about. Go into medicine, into neurosciences when you're sure about it. Do some internships, get exposed. Don't look into one direction. Talk to various people. Travel, get to know other cultures, and to learn humility and a humble approach also is extremely helpful for being happy later on. So the brain is, as you say, there's no health without brain health. That's for sure. We cannot make decisions. I personally love the approach of One Health, meaning human, animal, and environmental health, to brain health. That has not been done, and we're also just submitting a paper on that. And within the Lancet One Health Commission that I'm co-chairing with a colleague, we are also approaching now health, but also neurology, neurosciences, brain health from a One Health perspective. So there is novelty. There is the technical, the imaging, the technical tools they are developing. We can look further and further into the brain, so we can go deeper. But at the same time, there's a tendency and a movement out there to go broader, to also talk to the psychiatrist, sure, talk to the physician, sure. This is still biomedicine, but now you talk to a health specialist, a global health person, a One Health person. You go and talk to a public health person. You look at the system. You take a systems approach now to neurosciences. And that is opening fields that are really, really fascinating, crazy. But just don't lose curiosity. Be sure that you want to do what you're opting for. So brain health, be sure about it. You go and test it out. And then you launch yourself really 200% into it. And you go deep, but you don't lose the sight of other disciplines, of other sectors, even moving away from the academic sector. What can you do with your work to even influence politicians to change policy? We just talked about access to medicines. So there's so much we can do with brain health. And I also want to conclude by saying we know from the global burden of disease studies that neurological disorders are actually number one when it comes to morbidity. They're number two when it comes to mortality. But for morbidity, they're number one. 1 in 5 will get a neurological disorder roughly in their life. So it is something where you can really, really change. You can effectuate changes by bringing something new to the table within brain health. And thanks so much, Tissa, for the invitation to talk to you. It was fascinating, it was enlightening, it was inspiring. It was long, but I think I could go on forever. Thanks so much.
Thank you so much, Andrea. I agree. I throw some of the examples and stories from my end also to drive home the messages that you are bringing in to convince the viewers that why we are talking like this by giving some examples from our end also. I know that we can go on talking about these things for hours, but we both have a lot of other work to do. And I should get some sleep also for tomorrow. That is important for brain health.
That's exactly.
And,
so lack of sleep is not good.
And to wind up, basically what Professor Andrea Winkler is saying is that be passionate on what you wanted to do. Check what is your inner calling is. Think big, collaborate, look at the big picture, be broad-minded, never lose the sight and maintain your curiosity. You need to be curious. And she also touched upon the systems science approach, which I believe is probably the key pathway to finding solutions to the issues that we grapple with, 1 in 5 suffering from neurological disorders being the leading cause of disability and second leading cause of death. Thank you so much and stay well and all the very best. And we look forward to catching up with you at future coalition meetings and doing further collaborative work as we continue to unravel some of the mysteries. Take care.
It was a pleasure, Tissa. Take good care of yourself. Bye-bye.
Bye.